Hello and good evening, good morning. There was one particular question on NEET Recall. A CA lip was given and the different modalities of tissue sampling was given as options, and the student was asked the right option. Now, before going to the right option, let me talk about this particular issue. Now, this particular photograph is from Dr. Devi Prasad from Jipmer. He's HOD plastic surgery. He was kind enough to share this photograph with me. The other pictures which I'll be showing you in the presentation are from my personal collection. We'll be showing it to you also. Now, what I want to tell is, see how they are not just asking as a spotter. This image is a CA lip, acanthosis, or psoriasis, or a drug reaction. No, they give you the clue straight away that it is a CA lip. Very clear-cut image. They might have mentioned in the stem also. But then they want you to know the practical applications. It is not just doing spotter recognition. It won't help you in your clinical practice. So what were the options? Probably these were the options. This is by getting feedback from many students and trying to distill into a sensible looking option list. Fine needle aspiration cytology, an incisional biopsy, an excisional biopsy, or an imprint smear. I doubt whether imprint smear was given or some other option, but I have purposely included this as an option in my question so that I want to emphasize what exactly is an imprint smear. So is it a fine? You can see another CA lip here at the angles. You can see a CA lip. Is it a fine needle aspiration cytology? This is a surface lesion and it is ulcerated. What is the point in just picking up the surface cells? You will not get architecture. So that cannot be, that is not the ideal method. What about an excisional biopsy? Now you think you want to excise this purely to get a biopsy report, then that defect has to be closed with extensive reconstruction. And it's not only the lip, you will be taking out the gingiva, probably the tooth, part of the mandible, a whole lot of things. Please, I have made a presentation on oral CA. It is there in my list of videos. You can go through it. Everything is given in detail. Now, if you want to do an excision, I'm not talking about excision of the tumor. I'm talking about an excision to get a biopsy. It is because reconstruction is mandatory, and without a histopathological confirmation, you cannot be rotating flaps all over the place. Could it be an incisional biopsy? Yes, it can be an incisional biopsy. This marking is for the excision part. It's not for the incisional biopsy. So you can do an incisional biopsy. Only thing is take a bit of the normal surrounding skin. So that is known as an edge wedge biopsy. I'll come to it in detail. What about an imprint smear? Not warranted here. Yield will be less. Number one, it's almost like an FNAC. You just take a glass slide and press on the tumor part and try to stain it and see. You'd see individual tumor cells. Yield will be less. So you can do an incisional biopsy itself because it's not warranted in this setup. I'll come to you when we do an imprint biopsy on a CA oral cavity. We'll come to it further down the slides. So the answer is you will do an incisional biopsy. Now let's talk about an incisional biopsy. Now this is ruled out because there are ulcerated lesions in the oral cavity. Any ulcerated lesion, you can take a biopsy. No need to do a FNAC. Out of these three, what is fitting in is an incisional biopsy for this particular case, for that CA lip. Can we do an excisional biopsy? We will come to it. Can we do an imprint? Yes, you can, but the scenario will be different for both. Now, can you do an excisional biopsy? Yes, in the tongue. Superficial, very small lesions, you can do an excisional biopsy straight away. What about imprint smear? These were the two which we did not have a possibility in the CA lip. Look at this large lesion almost replacing the whole tongue. Now, you cannot be doing an incisional or an extensional biopsy is out of question. Incision also you can't do because if they bleed, you cannot stop it. It will be impossible for you to dig into the depth or to put a compression and stop. So what you'll do is an imprint smear. This is not the imprint smear of this patient. What this is actually a lymph node which has been pressed onto the slide to get an earlier report. We were suspecting a lymphoma for another patient, but this is what happens in an imprint. Take this slide and just press it on the tongue and you'll be seeing the malignancy cells. What this is for a lymphoma, we have pressed the lymph node on this and taken out the lymph node and stained the material on the glass slide. Okay, now what will you find on a biopsy? See the normal skin. This picture is from the net, it's from the web path. You can see that the skin thickness is normal. And then these squamous cells have not gone down into the dermis. What happens when there is a carcinoma? The squamous cells will move into the dermis. Not only that, the individual cells itself will be hyperchromatic. They will be irregular in shape, whereas these cells are so regular, the nuclei are so regular. Here they'll be enlarged, there'll be mitotic figures, and they'll be invading into the dermis. So this is your normal skin and this is your cancerous skin. Now, this is exactly, if you have a bit of normal skin, it is easy for the pathologist to compare side by side and deciding that the squamous cells have gone below into the dermis. Whereas here difficult, if you take only this, difficult for them to compare. So always take an edge wedge biopsy. I will show you how exactly to take an edge wedge biopsy. So this is the edge. This is your edge of the tumor. Okay, now how will you take a wedge? Let's have a look. See, take a bit of the tumor, and I've also included normal skin. So you're in the edge and you've taken a wedge. This is known as an edge wedge biopsy. So this part will be probably showing this, or it may be even in the transition zone. But we are doing our best. That doesn't mean you'll go and chop off half his lip to do an incisional biopsy. Fair enough, you will do a clinical skin edge. Now, there will be keratin pearls in well-differentiated carcinomas, in well-differentiated squamous cell carcinomas. Keratin pearls will build up. They are eosinophilic material. That is pathognomic of squamous cell carcinoma, well-differentiated. Now, not only that, they can invade the smooth muscles. Like in your lip, underneath you have the orbicularis muscle. So, it can invade those muscles. You can see the tumor cells have started going into the muscle. So, this is invasion. These are the squamous cells which are invading already into the muscle. So, the T staging will change. Even though clinically the orbicularis muscle may be doing its functioning of closing the mouth, but still you will have invasion. The T staging will change. Now, if you have a doubt that there is a group of cells sitting in the dermis, you don't know whether they are squamous cells, you can always do a immunohistochemistry with your cytokeranins. When you do with cytokeranins, if it's positive, you know it's a squamous cells there. So this is a very brief. I did not even only talk about what biopsy to do. I also told you how the other options are not possibly suited for this patient, or they can be either they will be underperforming in the biopsy, or it's an overkill for that patient to do that particular biopsy. So I've also brought in the other options where you can apply the other options, and a little bit about why you should take normal skin also in an incisional biopsy for comparison's sake. And number 2, we brought in the immunohistochemistry, the histological picture. There is no point just talking to you about a biopsy and keeping quiet. So I wanted to bring in a little more of the pathology also. So thank you very much, and please do keep these things in mind when you're answering a question. Nowadays the STEM has started getting very fine-tuned, convoluted, but basically at the end of the day it is a very practical concepts are involved. Thank you. Please do share and subscribe, and also visit my Telegram channel.